add on to the efforts that the Ministry of Health will be undertaking in the next couple of weeks regarding the COVID-19 vaccination exercise that we are all anticipating. So I'll introduce Mr. Banda Kuwani, who is a fellow health worker like most of us, and he is also the health informatics specialist at IHM, and he will take us through what this feature is in COVID, in legacy SmartCare, and we'll be able to demonstrate both how to utilize it and how easy it is actually to utilize it, but also the benefits in terms of the reports and registers that we can actually get from SmartCare using this data. Yeah, so Kuwani, without preempting too much of what you're going to do, please take us through, and thank you very much. Your designation and the institution that you're representing for the purposes of a register. Thank you. Kuwani, over to you.
Good morning, everybody, and thank you, Dr. Miti. Thank you, Dr. Miti. Good morning, everybody. I hope everybody is well. My name is Kuwani Banda. I am the clinical informatics specialist at IHM, Southern Africa. And this morning/afternoon, I'm going to take you through COVID vaccination data capture in SmartCare Legacy. So for today's demonstration, I will give you a brief introduction, then I'll go into a hands-on vaccination features or functionality in SmartCare Legacy. So a brief introduction. This will be done by a brief presentation. Introduction. 2.1 million people have been vaccinated in Zambia. COVID-19 vaccination is being administered in about 2,300 health facilities in Zambia. About 1,500 facilities are using the vaccine registry for data collection and reporting of COVID-19 vaccinations. The vaccine registry is the DHIS COVAX vaccine registry. That is the Ministry of Health's tracker for COVID vaccination. There is an opportunity to monitor vaccinated clients using the National Electronic Health Record System, which is SmartCare Legacy. So the goal of this functionality is to provide clinicians and data entry staff access to COVID-19 vaccination data in SmartCare. The vaccination type, the dose, the date, and the identified comorbidities for clients with electronic not to replace COVAX or the vaccine registry, which is the primary tracker for the Ministry of Health, but to supplement it. SmartCare has added this functionality so that we can track our clients using SmartCare in conjunction with COVAX. I will repeat that. This functionality has not come to replace COVAX. So the procedure first, then supplementedly entered into SmartCare. Move on. So the manual entry of vaccination data in SmartCare. So the terms of how we're going to enter this data into SmartCare. Option 1, vaccine registry and SmartCare. Vaccination data entry into vaccine registry, which is the DHIS COVAX at facility level. List of COVAX vaccination at the facility, including those with HIV as a comorbidity, is printed out from the registry using the line list functionality in GHIS. Then for into SmartCare manually, and this will be stored in the patient record. The option 2 is the data is captured from the client as the client comes to access any of the health services from the facility that is using SmartCare, be it OPD, family planning, or ART services, and they do have a vaccination status, be it they have been vaccinated or not vaccinated, and they do know their status. This will also be entered into SmartCare using the information from the client. The second option is as the clients come, some move around with the vaccination card, the national card, the green one, and data can be derived from that vaccination card. The third option is data is captured from a printed form from the vaccination registry. I think we spoke about that in earlier on. And then just to emphasize the point that data is entered in both vaccine registry and SmartCare, and not just SmartCare. So that data must be entered into vaccine registry, as that is where we'll also derive the COVAX number, which will be then entered into SmartCare. So that was a brief introduction. I will go ahead and share my screen with for the actual demonstration on how we're going to enter this COVID vaccination data for all the clients in SmartCare. Great. For today's demonstration, I will be using Chikando Rural Health Center in Chipata. There is no live data. I've just used the facility as a demonstration. There is no live data in this database. So all the personas are made up, and just for this for demonstration purposes only. We'll log into SmartCare the way we usually do, and we'll obviously search for the client. I already have clients who are already made just to save up on time, so that we can go through the different scenarios of how this vaccine, COVID vaccine, will be actually the data input will be done in SmartCare. So the first scenario, the first test case I have is a child who is below 12 years old. Why did I choose a child below 12 years old? Because according to the guidelines from MOH, COVID vaccination in Zambia is only eligible for those who are 12 years and above. So we want to ensure that we cannot access the COVID vaccination data or data entry for clients who are below 12 years old. So I will go ahead and search for a client. My client, just give me 1 minute. My client is called David, who was born in 2010. So when I've already, as I said, I've already conducted the registration for this client. And as you can see, the client, I am able to access the client. The client, as you can see on the dashboard, is 11 years old and male. And if I may bring your attention to the top right-hand corner, to be something that's new, that you may see that is not in your current legacy version in the facilities as we speak. This is the COVAX. This is where the COVAX or the COVID vaccination module is situated. It's in the top right-hand corner in the client interaction history page. So I am not able to access it. It's grayed out because the client is not eligible according to the MOH guidelines, that they're not eligible for having a COVID vaccine in Zambia as we speak. Right now, it's 12 and above. So just to demonstrate that when the child is, or when the preteen is 12, they will have the actual process, the data entry process. I will go ahead and just slightly edit it so that we can just appreciate. I'll just edit the year of birth to make this child above 12. Okay. Sorry, give me a minute, sorry. Okay, I'll go ahead and save that. And now we have the process of COVID vaccination in SmartCare. So the first thing that what would happen when any client is accessed who is eligible for the COVID vaccination will have a mandatory prompt. This prompt will ask the question, is a client vaccinated against COVID fully or partially? When I say mandatory, this prompt will appear every time you access this client until we actually answer this question, if the client is vaccinated against COVID or not. We can try to access we can cancel it, but it will still come. So it's a mandatory prompt. So basically we must ask these questions to our clients. Are they vaccinated or not? So for this client, for David, our first persona, will actually they are actually vaccinated. They were given consent. Consent was given by their parent since they are only 12. As we all know, consent has to be given for those children between and teens between 12 and 17. So consent was given and they were actually vaccinated. They've actually said, no, we actually have a COVID vaccination. So we'll go ahead and navigate to yes. When we actually highlight yes and pick yes as they are vaccinated, the system will auto-navigate to the COVAX submodule. The system will navigate to the COVAX submodule. In the submodule, well, I will go through all the data elements, the data entry elements, so that we are clear on this. The first one, we have the COVAX card number. We have the COVAX card number. And as I stated before, this is derived from the vaccine registry or the DHIS COVAX. So this just entails that we have to enter the data into the COVAX before we enter into SmartCare. I'll just give an example of, so let's say the client we have derived the information from a printed out list and we have their COVAX number. I'll just give an example of a COVAX number. I'm just giving an example that this number will be derived from DHIS COVAX. Then we have the pre-immunization questions. Does the client have any underlying conditions? No or yes. When we access this submodule, it will be automatically or no. We have to query this client if they do, or access in the COVAX. That information will be available from the DHIS vaccine registry. So just in case we have it's yes, if we click on yes, as you can see, this activates the underlying conditions. When you click no, it grays out those underlying conditions. The second question is the client pregnant or lactating. This is only applicable to female clients. This is only applicable to female clients of a certain age. I will go ahead just to demonstrate in case they have, I'll just give an example in case they have cancer. I'll just give an example. It's just an example so that we can see. And we can pick what is applicable. You will notice that HIV is grayed out, and it has automatically or no. This is because for HIV or for our clients who are on treatment, we are actually using the system. We actually applied some logic, and this will be detected from either a positive HTS result or from a client who's on treatment. This will be demonstrated with my next client. In case the underlying conditions are not part of these 4 underlying conditions, we have a provision for others. In case it's not, the client may have another underlying condition which is not part of these. We have the provision of other here down here, and this activates a free text box, which we can actually just have data input. For example, the client may have chronic asthma, which is not part of those, but the client experiences chronic asthma. I'm just giving an example of something that that we can use there, the free text for. Then we'll move on to the vaccine information. We have vaccine information on the right side. First, we have vaccine dose 1. Vaccine dose 2, but as you can see, dose 2 is grayed out and booster is grayed out. This is according to the guidelines. We must have the first dose, then the second dose, if applicable, and then the booster dose eventually. So for this client is only 12 years old, and according to the MOH guidelines, the only vaccine that is available vaccine, and SmartCare has that logic. As you can see, we do not have the other vaccinations available as an option. We only have Pfizer as between 12 and 17. Pfizer is the only vaccine allowed to be given to these clients, and after 18, we have the other vaccines. So I'll go ahead and give Pfizer. The scenario is that this client got this Pfizer on the 1st of February this year, so we can actually backdate this vaccine. Okay, when that is done, it will open the date of vaccination. I can backdate it to the 1st of February 2022. We do have an option for the vaccine batch or lot number. This is also can be derived from the vaccine card and also from the vaccine registry. It is not a mandatory field. It's an optional field, just in case that information is available to the clinician or the data entry staff who is actually entering this data. We'll move on to the client. The client informs us that, or from the COVID vaccination registry, we do know that the client had a second dose. Let's say 6 weeks later. So that would be the 2nd week of March. So we go ahead and we look for the vaccine name. Of course, we only have Pfizer as the option, as stated earlier. Okay, and then same procedure as the first. We enter the date that this client actually got the second dose, and there and of course, as I said before, the vaccination batch or lot number is optional. In case they did get a booster dose, we have that provision as well. This also uses the actual guidelines for the booster doses. So we do not have all the vaccines. There are guidelines on which, like, let's say, for example, if Pfizer is the vaccine that somebody was vaccinated against, there are limits on to which which boosters can be given. So we have actually implemented that in the SmartCare system, and we've actually implemented that logic. So I'll just give an example in case they got Pfizer again. I'll just leave this today. Then of course, we can move on. I'll move on to, is the client fully vaccinated? This, again, we have added logic to this. This will not be a manually data input field. This will use the logic behind what is who is partially vaccinated and who is fully vaccinated according to the guidelines, the MOH guidelines. And as you can see, once they have two vaccines for Pfizer, they are actually fully vaccinated. As you can see here, the client is fully vaccinated. If there was just one dose, they would be partially vaccinated until they receive their second dose. For Johnson & Johnson, that just needs one dose. But for the others, it will need 2 doses. I'll move on to verified. Verified is something, in case the information is actually verified either by vaccination card or by the line list, which is derived from the COVAX registry. So we could, if that information for the provider or the data entry staff who's actually entering this data, if they have that verification, they can actually highlight it here. If it's just by word of mouth from the client, of course, we do trust the information from the client, but it's not verified. So we'll just leave that open. In case it's just from information from the client. But if you have a means of verification, which could be the vaccine card or the line list from the data from the COVID vaccination registry, that is a form of verification. I'll move on to the next data entry, which is what we call the adverse event following immunization, or which is abbreviated as AEFI. In case the client did experience any adverse event following the immunization, this could be asked from the client or also derived from the registry. If they did not, we can just say no. If they did, we can say yes. We can highlight yes and yes. That opens up 2 fields, which is the description of the adverse event and the date of the adverse event. On the description of the adverse event, we have options of the common adverse events that follow an immunization, which are the swelling, pain on the injection site, joint pain, malaise, fatigue, body aches, fever, and an allergic reaction. But if the client experienced an adverse event which is not part of these options, we do have the provision for other adverse event. When we highlight that and choose that, we actually get a free text which can describe the adverse event which was not part of those options that were earlier shown. And of course, we have the calendar to pinpoint which date the client started experiencing the adverse event following immunization. Okay, I'll go back to no. Just the client did not experience. I just wanted to demonstrate that. Then once I am done with all the fields, I'll be able to save this data. We have the save button at the bottom of the sub-module. We have the save button at the bottom of the sub-module. Well, I'll go ahead and save, and SmartCare will then prompt and inform me that the data has been saved successfully into the system and it has persisted to the database. I can then click OK and then close the sub-module, and then go ahead and now provide the service that the client came for, including if it was just the COVID vaccination itself, which is also a service. Especially that now we're going into the campaign for the vaccination period starting from the 14th. Okay, so that is basically a typical way of to navigate SmartCare for a client who has actually had a vaccine beforehand. I'll then go ahead and demonstrate for a client who's actually having a vaccine that on that same day. Okay, we can go ahead and just, since it has saved, we can just go to previous. And for the second scenario I'm going to demonstrate is a client who is on ART. So I'm going to demonstrate a client who's on ART, and I'll repeat, these are not real clients. These are dummy clients for demonstration purposes. So my client's name is Chanda Kavumbu. As you can see here, they actually even have an ART number. So I'll access the client. I can search for the client. I can search for the client here, or yes, let me just do that. Okay, I'll search for the client. I will of course confirm using the details that this is the right client I'm accessing before I select the client. As stated before, the prompt is mandatory. So once you upgrade to the COVAX, this special upgrader for SmartCare, all our clients will have to have a vaccine status, not just a vaccine if they are vaccinated, or if they're not, we'll also demonstrate that. So I'll quickly go through this client, since I want to demonstrate a partially vaccinated client. So yes, the client is vaccinated today. They come for ART services, but they also actually want to get vaccinated today. So even if I say cancel, and let's say for example, I access the clinical follow-up, and then I actually see the client, I go ahead, I see the client, and I do what I'm supposed to do with the client, and I save it. The moment I save it, but I won't save it now, I just want to demonstrate, the moment I save it, it will still come back, this prompt will still come back, and it will keep coming back until there's an actual vaccine status. So basically, we have to have all the data for the vaccine status for every client who is in SmartCare, in a nutshell. For this scenario, I'll go back to the scenario where this client is partially vaccinated. They've accessed the AstraZeneca vaccine today. I'll click on yes. As demonstrated before, this brings out the COVID submodule. We can put the number there, which is derived from, as I said earlier, from this is derived from the COVAX registry. We'll go through the same process that we did before, which is are there any underlying conditions? As you can see, this as I've just opened it, it has gone straight to yes. Why? Because remember the client is on ART. That means the client has an underlying condition, which is HIV, and as you can see here, it's on auto yes. So the system has helped us out to identify these clients, so that we don't have to do the manual input for these clients. I'll go ahead and just give the client has accessed AstraZeneca. Actually, I want to I'll backdate it to March, just to illustrate the prompt that will come to remind the facility staff that SmartCare will also have a prompt to remind us that the client is due for the second dose of their vaccine. So I'll backdate the date to 1st of April. And that's when they got their vaccine. And as you can see here, on the question, is the client fully vaccinated? As you can see here, it's on no, because they're not fully vaccinated, because for AstraZeneca, as we all know, according to the guidelines, we will need 2 doses to ensure that the client is fully vaccinated. And the client did not experience any adverse events, and this is verified. I'll just do that, and I'll just save. The data has been saved successfully. I'll close the vaccine registry. I'll go back, and then I'll try to access this client again. Okay. I think it doesn't reach I think I was supposed to, I'll go back and so we can, when we go back, we can actually, there won't be a mandatory prompt since there's already a partial, there's already a partial vaccine. So in case the client has a second dose, we can access the COVAX on the top right hand here, and it will give us the information from the first dose, and we can just continue with the second dose in case they had it today. I'm just giving an example. They had it today, and then we can go ahead and save. Okay, so that's for the second client that we've actually fully vaccinated. So the third scenario, the third scenario I'd like to give you is client who does not have a COVID vaccination, because as we all may know, that not all clients have access or have undertaken the COVID vaccination, but since SmartCare is prompting all clients who are accessing the system, they will need to put a status whether they have been vaccinated or not vaccinated. So the third scenario is Mr. Emmanuel Mukuka, who's 62 years old. Mukuka, Manuel. Okay, so this client is Mr. Emmanuel Mukuka. So when he has come to access she has come to access let's say, for example, she's come to access from OPD. We'll go ahead and click on no, because when we ask her, have you been vaccinated against COVID? She says, no, I have not been vaccinated against COVID. We'll go ahead and navigate to no. That will also, the no as well will also call out the COVAX vaccination. Just give me a minute. Okay. This will also call out the COVAX submodule. As you may notice now, the number is grayed out, and all the other information is grayed out for the vaccine itself. All we have the questions down here, the three questions, which are: was the client offered vaccination? So in case the client has never been offered vaccination, they can state whether they've been offered vaccination, not on that day, but even in previous interactions with the clinic, or maybe there was door-to-door vaccination. But if they've never been offered, they can actually give an answer. For example, mine has been offered. Then the next question would be, does the client want to get vaccinated today? This client does not want to get vaccinated for whatever reason. Of course, as health workers, right now there's a campaign. We are encouraged to make sure that all eligible Zambians are vaccinated against COVID. That is why we're even having a mass vaccination campaign coming up next week. But in the scenario, or in the case that the client declines, that they are do not want to be vaccinated, and after we have counseled them and given them the benefits of why being vaccinated against COVID is important and can actually save their lives, and they still do not want, we want to know why they would not want to be vaccinated against COVID. So we'll go ahead and say no, that they do not want to be vaccinated against COVID. And this will also open up a drop box for the reason why the client is not vaccinated against COVID. So we have some reasons or options for reasons why the client is not vaccinated against COVID. We have personal beliefs, religious reasons. Maybe the client is afraid of the side effects. of the vaccine. Maybe they have had COVID before and they feel they have gained natural immunity. The vaccine may not have been available at that time. And then, of course, we have the other reason, which could be, which we could specify the reason. If the reason is not part of those options that were there before. But for my client, we'll just say that she has personal beliefs that she does not want the COVID vaccination. She does not believe that it will work on her. We go ahead and save. Once SmartCare prompts us and tells that the data has been saved successfully, go ahead and press OK, and we close the COVID submodule and go ahead with the services the client came to be offered at the facility using SmartCare. Okay, so at this juncture, I'll do a summary of the 3 scenarios that I've given for the client who is fully vaccinated, above 12, another client who was on ART and fully vaccinated as well, and for a client who was who is not undertaking the COVID vaccination itself. So these are the 3 scenarios. Of course, there'll be other scenarios that, of course, will be supplied with the job aid. There will be a job aid coming out with this upgrader, and of course, they will have the release notes, which will also guide us on how to undertake this this module. I'll repeat, it's a mandatory module. That means we have to fill this out. We have to give them a vaccination if they are or they are not. We have to have that information in SmartCare. I will go ahead quickly just to demonstrate the 2 reports that we have actually developed for this data entry. We have 2 reports. One is an aggregate report, which aggregates the numbers of the vaccination and those not vaccinated. The other is an identified report or register, which is what we're calling the COVAX register, which has the names and if they're fully vaccinated or not, or the reason why they have not been vaccinated. So I will demonstrate firstly the identified report, which is the COVAX register. As per usual, we'll go through to the menu to access this report, and we'll navigate to the show reports. When we click on menu, when we are on the home page for SmartCare, we'll navigate to show reports. And this will then navigate to the reporting module in SmartCare Legacy. We'll navigate to the identify. We have these 5 levels of which type of report it is. We'll move to the identified or the ID client lists. We'll navigate to the ID client list and scroll down, and when we look for what we are calling the COVAX register. You will find it, since this is actually alphabetically arranged, you'll find it on the C, which is the COVAX register. It's a list of clients vaccinated for COVID and those who are not. So, as per usual, using for every SmartCare report, we'll select the parameters and run the report. For this clients who have a vaccination status in SmartCare as of the day you are running the report. I'll navigate to go. Wait for as usual, wait for the report to load, and once it is ready to view, it will change on the report progress. It will change and say the report is ready to view. I'll go ahead and highlight that, click that, and to give me these 3 options, and I'll pick the first option, which is the view this report option. Okay, once that is highlighted and picked, we'll have the actual COVID register. Are we able to see my screen of the register? Okay. It has the new PIN, that is the national unique PIN number from SmartCare. It has the ART number for this is only applicable for those clients who are on treatment on ART. It has the COVAX number. Remember that number that is derived from the vaccine registry, the DHIS. It has the demographic details, the first name, the surname, date of birth. All these are derived from the registry. So we must ensure that registry is, when we're doing registration of these clients, there must be a full registration, as those details are then persisted to this report. We have the age, and of course we have the NRC. NRC in this case is very important because it's another way to identify the client it's another identifier, unique identifier from the COVAX registry. Okay. We have the sex, the mobile number, all these are derived from the registration module, the address as well. So please let us ensure that we actually have full registration when we are actually undertaking this for any client in SmartCare, basically, because we'll need those details as they are persisted. One dose one, and you need to follow them up for the second dose. We'll need those details so that we can follow them up if they are missing on those, they've missed their date. The next column is the client on ART. Of course, we'll remember, if you could recall, we only had one client on ART, and that was Chanda. And as you can see, that is yes. The vaccination status. So this report is for both those who are vaccinated and those who are not vaccinated. So the first client, Emmanuel Mukoka, as you may recall, was not vaccinated. As you can see here, the reason is there, not vaccinated. The type is of course not applicable. Fully vaccinated is not applicable. The reason not vaccinated is applicable because they are not vaccinated, as we did in the COVID submodule, and it has actually shown the reason why they are not vaccinated. So if we want to do some analysis at facility level, or why in this certain area, why are clients who are not getting the vaccine, we can actually do that because we have that provision to say why the client is not accessing or does not want to have the COVID vaccination. For those who are fully, we have the vaccination type and the date they were vaccinated. For those who are fully vaccinated, and even for those who are partially, you can also have a partially here as well. It will also give you the vaccination type, and it will not show the fully vaccinated until the client is fully vaccinated. These reports can be exported to Excel and CSV as well for further analysis, as per usual for every SmartCare report. So, ladies and gentlemen, this is the COVAX register in SmartCare, just to show any client or every client who has actually gone through the submodule will actually appear on this register. I will quickly navigate, because I've seen that I only have 10 minutes left. I'll quickly navigate to the aggregate report. We have developed an aggregate report as well, just for ease of verification in SmartCare as well. Okay, I'll just close this. The aggregate report is found on the aggregate section in the SmartCare report. So I'll start from the SmartCare, I'll cancel that, and I'll start from the SmartCare homepage as well. Again, I'll click on the menu, which is found on the top left corner. I will navigate to the second option, which is the show reports. The show reports. I'll highlight that. I will then navigate to aggregate, because this is an aggregate report. It's not an identified report. And as stated before, these are set out and they are arranged alphabetically. So we'll find it on the C, and you can find it here, the COVAX aggregate report. Okay. So I can, as per usual, I will select the parameters and run this report as I did before For this one, we do have a start date and an end date. For example, I want to know since January, how many clients from my facility do we have the vaccine the COVID vaccine status, not just the vaccine itself, but the COVID vaccine status for the client. So I'll use my start date as 1st of January up to today, which is the 11th of May, 2022. Once I have selected dates, I'll go ahead and run the report and wait for it to be ready for viewing. Okay, as we can see, the report progress has stated that the report is ready for viewing. I will go ahead and highlight it and select the report. I have the 3 options as shown, and I want to view the report, so I'll select the first option, which is run this report. So this is the COVID aggregate report. It has the disaggregations according from we have used the disaggregations which are in line with the MER report, and which are the 10 to 14, 15 to 19, 20 to 24, 25 to 29, 30 to 34, 35 to 39, 40 to 44, 45 to 49, 50 to 54, 55 to 59, 60 to 64, and 65. And we have separated the males and the females as well. So we have the totally vaccinated, the entire facility. We have the fully vaccinated. So total vaccinated, this includes the partially and the fully vaccinated together. Then we have fully vaccinated. How many in the facility are fully vaccinated? How many are partially vaccinated? How many have actually experienced, this is general, a booster vaccine, who have actually undertaken a booster vaccine. And then we actually made this final for those clients who are on ART. So the ART, the numbers from the ART sections or columns will be subsections of, subsets of the total. So for example, there will be total vaccinated on ART, fully vaccinated on ART, partially vaccinated on ART. Those ART clients who have actually had the booster and vaccinated vaccination, and then we have those who are not vaccinated and those who are not vaccinated on ART. Okay, so this is the actual report, and as you can, if you remember our 3 scenarios, we have those 3 clients. And as you can see there, the female, the client who was on ART was a female, and she was in the between 40 and 44. As you can see, she's actually here. And then we have the sum here as well. For those vaccinated and for those, of course, this report is, you are able to export this report, Excel, PDF, as a Word or as a CSV. Ladies and gentlemen, that is a brief demonstration on the COVAX functionality in SmartCare. Soon in time for the campaign. So there's your facilities will be having this upgrader will be shared to your facilities. So in time for the COVID vaccination campaign, which is starting next week. Before I open the floor up for questions, I also just want to state that as this is a special upgrader, there are it is built on top of the previous upgrader, which is the 22nd of March upgrader. It is built on the 22nd of March upgrader. So all the features of the 22nd March upgrader are the same with this. All IHM has added is the COVAX functionality in SmartCare on top of the 22nd of March upgrader. Thank you very much. Over to you, Dr. Zyambo.
Thank you very much. Very comprehensive presentation, I must say, and I think there's I hope that our participants have been able to appreciate. I know this is just an introductory to this system. A lot of questions and a lot of things that are not so clear, but let's try to get some answers. So I'll give an opportunity. I'll ask Dr. Sam just facilitate this section in terms of question and answer. And then we can also get a comment from Dr. Dien Mwansa as well, as just to give us an idea on the upcoming campaign. Thank you.
Sam, good afternoon. Can I go ahead?
Yes, please proceed, Edson.
Thank you. Kuwani, thank you so much. That was a very good presentation, I must say, very comprehensive. But I have only one question. Are there any immediate plans to make the register exportable to Excel? Thank you.
Okay. Should I answer one or should I take a bunch of questions?
I suggest that we take a couple of questions and then we see if we can answer them. And also, I'll also mention to you, the ones that are in the comment box, in the chat box. Yeah, thank you. Proceed. We'll ask, can see all the hands. We have Edson, and we have Asfar, we also have Konje, and Jamie and Boy in that order. We'll just take one round of questions. Just be quick in view of the time. Asfar, please proceed. Okay, can we have Jamie in that case?
Yeah. Good afternoon. Are you able to hear me?
Yes, we can hear you.
Okay, Kuwani, thank you very much for the presentation. You've really done a good job. I have one question. In the case of ART clients that come to the facility and they verbally indicate to us that they've been vaccinated, but they don't have any proof in terms of documentation, how do we go about that? Thank you.
Thank you very much. We can proceed to Atupele.
All right, thanks very much. Kuwani, following up just on the presentation, from the screen, for each patient that you open, you had the pop-up that was coming up on the screen. I would just want to suggest it would be nice to have a notification like the way we have for VL, rather than having it block the whole screen. Just a comment from me. It would be nice to just have it pop up like that we have those VL notifications coming up rather than blocking the whole screen. That's all for me.
Thank you. Asfar. Okay. I think Dr. Asfar may not be getting us, but Kuwani, you may also want to address the question from Paul, which speaks to when the release, and I think you've already addressed it, as to when the facility will have this upgrader. And the same was a question from Oliver. So you can proceed and answer those 4 questions.
Okay, thank you very much, Dr. Miti, and thank you very much for the questions. So for the first question, if you can export to Excel, I think, I don't know if you're able to see this screen that I've exported to Excel already. Let me try and see. Okay, change the. Okay, Are we able to see the screen that it has been exported to Excel? Okay. So yes, so as I stated earlier, we were able to export to all the usual formats that come with SmartCare reports, doc, CSV as well for further analysis. The second question is the proof of vaccination. During the demonstration, I did state that if the way we've set up this and we've set up the COVAX, if a client does not have any proof, they can still give that information. If a client says, I have come, if you ask a client, be it ART or OPD or family planning, and they say, oh, I have been vaccinated. As per MOH instructions, we'll be told that we'll take that as the truth. So we have to enter that data into the system as well. That's why we have that option for verified. If it's verified, that means they have the card, or they are verified from the COVAX registry line listing. But if they just say, I have been vaccinated, the requirement was that we actually enter that vaccination status and that date. We can, if they don't have the exact date, of course, we can just try to estimate. Those were the requirements from the program. The third one, that's from Matupere, was that we wanted for it to be more of a notification, like the way it is for viral load. As per requirements, right now, as we know that COVID is a very, very serious disease, and the requirements state that we must know the vaccination status for all clients or all people in Zambia. So that's why this is mandatory to know as a client is accessing SmartCare. We're not saying that the vaccination itself is mandatory, but their status, to know their status. We want to know the nation wants to know the status of the people who are vaccinated and not vaccinated. And if they're not vaccinated, we do have a mandatory prompt as opposed to just a notification, because to be honest, people ignore notifications, but this will not be ignored. So that we know as a nation or as a facility, you should know who and how many clients are actually vaccinated within your catchment area. The fourth one, when is this coming? I should think this should be out in the next 2 days. Your PHOs will be informed, and there will be a deployment for this special upgrader in readiness for the mass vaccination campaign starting next week. Thank you very much.
Thank you. Be out in the next probably 2 or so days, and that is just to make sure that the quality assurance processes are complete, in that it's undergoing some field testing as we speak. Yeah. So time is not so much with us, and I'm happy that this presentation has generated a lot of call it a day. I want to actually acknowledge the presence of Dr. Dien Mwansa, the immunization program manager at the EPI expand the Ministry of Health, and just want to invite Dr. Mwansa, if you can just make a comment or two, especially with regard to presentation and the activity ahead of us. Thank you, Dr. Mwansa.
Dr. Miti, I have followed and enjoyed the presentation. It was a good pace for me. Before I go further, I have to obviously disclaim that I'm not an IC for my following. in my day-to-day job, rather, I have a bias towards operational issues. So I think my comments might not be heavy on the technical part of the platform. In fact, each day I leave home, I say to people I'm going for work, pretty much what I do is operational. It's observation, explaining. Having said that, I have to say that this is brilliant work by the team behind this. And I do not think I have anything specific in terms of how this is intended to work insofar as capturing the information we need for those operational pieces I've spoken with. I can't say brilliant enough. That said, it's important to also put on record that some of the issues that you have spoken to quite real, and I think one or two other persons may have raised them as a contribution. Starting of the presentation, that the ministry is using the DHIS2 COVAX instance, and by and large, it works just fine at the moment. But we also appreciate the need for a platform such as the one that we've discussed, which is pretty much a mirror of the COVAX instance in DHIS2. What we have observed from the operational point of view, that is the program, is that when we have two platforms or more pretty much doing the same job, but necessitated by different needs, an issue of interoperability is one that the sector has struggled with. I know at some point, I think there was that demonstration of the possibility of exporting. I just wish to put on record the need to, again, cross-check why that platform of exporting and importing as being a bit challenging. It would affect, if it doesn't work as envisaged, it would affect, as I mentioned, part of what we do here. I spoke about the fact that basically we are doing observation, description, experimentation, and explanation. It's the explanation part that becomes difficult if part of the information is inaccessible. So interoperability, I think, is an area that has to be explored as opposed to exporting and importing. If it could be possible that at the click of a button, the two platforms are speaking with each other. Thirdly, at the moment, we do get daily reports from the COVAX instance that sits in DHIS2. These reports are presented to the superiors at the Ministry of Health every day. And I was trying to see whether that would be possible for data that would be entered in the platform we've discussed. But like I disclaimed at the beginning, I'm not an ICT officer, I might just have missed it. But I thought it's an important consideration to put on the table that access to information, if restricted to a longer duration, like a month, might not be, or even a week, might not be of great value to the decisions that we make with daily information. Number 4 is that, again, something I did quite eagerly look out for in the presentation and may have missed it, is the aspect of implementing some of the fast changing policies associated with any immunization program. By the way, this is not peculiar to ours. All vaccination programs are very fast programs and policies change quite very fast. A case in point is this. As it stands, the country does not have AstraZeneca. AstraZeneca being the very first vaccine that this country received on 12th of April 2021 and started administering on 14th of April 2021. in the absence of AstraZeneca, and scientifically so, the guidance is that those that have received 1 dose of AstraZeneca will be given Johnson & Johnson instead. Like I mentioned, the detail is quite clear in terms of why the decision was made. It's beyond the fact that both AstraZeneca and Johnson & Johnson are viral vectored vaccines. And so when this guidance was provided on Saturday, we asked our colleagues that are managing DHIS to effect that change so that a person that receives Johnson & Johnson as a complement to the first dose of AstraZeneca can be entered in the system, and colleagues responded within 20 minutes. I looked out for this on how it will be effected on this platform as to whether it would mean people have to travel to update or there are other means of updating. Finally, is the aspect of prompts and notifications. I have a lot of liking for a number of features for the platform, but this one stood out for me. I like it. However, I get the sense from the comments that some people might perceive that to mean that we are trying to make the service mandatory. I think prompts and notifications must remain. It is in the management of the information that we have to focus so that it doesn't sound as though this is being mandatory. So I think the tone that I got that we might need to water that down would be again detrimental to the program and what I spoke of as we do. In conclusion, Dr. Miti, once again, thank you very much for the opportunity. I wish to just re-echo that on Saturday, we begin the COVID-19 vaccination campaign. There is routine COVID-19 vaccination that has been going on since 14th of April last year. So we've been vaccinating, actually next week, we should be talking, not next week, this very week coming up. This very Saturday, sorry, 14th, we should be talking about exactly 13 months since we started vaccinating. So the campaign itself is a nationwide activity running for 10 days. And 2 weeks ago at a similar platform, we might have indicated that the country would deliver about 6 million doses. Thanks to a postponement, that status has changed. The country has enough vaccines to even reach everyone. So whilst the country's target is 70% by 30th of June, the country has enough vaccines to reach 100% fully vaccinated by 30th of June. And to respond to that, both government and partners, and some of them are on the call, including, I think I've seen a couple of people from CDC, thank you very much. Quite huge investments have been put in the program to facilitate all the requisite pieces. Mine, therefore, is to put that on the record and emphasize the significance of everyone taking part. For the reasons we have to do this are very, very well known. So once again, Dr. Miti, thank you very much, and over to you.
Thank you, Dr. Mwansa. In the interest of time, I'll not say much, but probably just to guarantee that yes, this information, this COVID-19 vaccination will subsequently be also updated in SmartCare Plus, but that is work that is ongoing and is not necessarily part of the upgrade that is going out in the field for field testing, but it will come as a patch quite very soon. Then there was, I think, a comment as well from Nelly, and I want to state that the HIV program gave guidance earlier that the COVID-19 vaccination status and updates and information can be recorded on the ART summary sheet, as there will be no additional paper form that will be introduced to capture this data. So I think that's a very important question, Nari, that you've raised and needed to be addressed before we go. So that this capturing of information does not substitute the COVAX register under the DHS-I2, okay? And therefore, even word of mouth information will be considered for this program, but for other information that relates to the final statistics and so on, the COVAX register is there, and the data capturing that has occurred in on that platform. So in the interest of time, I really want to say thank you very much to everyone who has had an opportunity to join this platform and to share on what is coming, and also to encourage everyone that let's prepare for the vaccine launch that is coming through. We are very grateful to CDC. We are very grateful to the Ministry of Health for the ongoing support and guidance that has happened over time to see us implement this COVID-19 vaccine upgrader or release that we are having. And also to all the diligent health workers out there, I salute you all and have a good afternoon. Thank you very much, Mr. Banda, and have a good afternoon as well. Bye, everyone.
Bye, everyone. Thank you very much. Bye, everybody.